Antihistamines. Histamines are biologically active substances, mostly generated in mast cells. They mediate a wide range of cellular responses, allergic and inflammatory reactions, and regulates physiological function in the gut. It also acts as a neurotransmitter and is a component of venoms and in secretions from insect stings. Allergic reactions are our body's immune system response to a foreign body. In an allergic reaction, mast cells release histamine to cause histamine toxicity. Symptoms of histamine toxicity includes flushing of the face and body, burning mouth, headache, breathing problems, etc. Antihistamines are drugs that antagonize the effects of histamine by blocking or inhibiting histamine receptors. They compete with histamine for binding sites at the receptors, but they cannot remove the histamine if it is already bound. Antihistamines can be used to treat allergic conditions, certain dermatological conditions, anaphylactic reactions, nausea and vomiting, sedation, gastroesophageal reflux disease. Antihistamines are classified based on the type of histamine receptor targeted. Antihistamines are mainly of two types: H1 antihistamines and H2 antihistamines. H1 antihistamines are competitive, reversible antagonism of histamine H1 receptors. They cause inhibition of increased vascular permeability and allergic bronchial constriction. These drugs neither inhibit antigen-antibody reaction nor histamine release. The H1 antihistamines are classified as first and second generation drugs. The major side effects of H1 antihistamines are sedation, headache, and anticholinergic effects. First-generation H1 antihistamines are the classical antihistamines. They are competitive inhibitors of histamine action at tissue level. They reversibly bind the receptors and can be displaced by higher levels of histamine. First-generation drugs can penetrate the central nervous system and cause sedation. These drugs are commonly used in the treatment of histamine-mediated allergic conditions. These drugs are used as sedatives, antiemetic agents, antalgic agents, and to treat anaphylactic shock and motion sickness. Second-generation H1 antihistamines are specific for peripheral H1 receptors. They are competitive antagonists at low doses and are non-competitive at higher doses. These drugs are polylipophilic and do not readily traverse blood-brain barrier. They are highly selective with little or no anticholinergic activity. These drugs are used as anti-allergic agents and to treat anaphylactic shock. H2 antihistamines act by binding to H2 receptors on the basolateral surface of gastric parietal cells. They inhibit histamine-induced stomach acid secretion. They have less affinity for H1 receptors. H2 antihistamines are commonly used as second-line treatment or in combination with proton pump inhibitors. Indications of H2 antihistamines include symptomatic treatment of stomach and duodenal ulcers, gastroesophageal reflux disease, Zollner-Ellison syndrome, and anaphylactic shock. There are limited guidelines for the use of antihistamines to treat children, elderly patients, pregnant women, and breastfeeding women.